Anger management. This is such a beauty because the mistake is already in the name. There is no such thing as anger management. When people say they want to manage an emotion, including anger, for example, it usually means that they think they can take a rational approach, which is understanding where the emotion comes from, in this case, the anger. And then when you notice that it comes up and it appears, you can regulate it by just knowing about it, by realizing it, and making the decision to not get angry. And this approach doesn't work. And if you have been told that you have anger issues or you think you have anger issues, then you will know that that does not work. And it cannot work. It's not your failure. It just can't. It's a futile approach. And among the emotions, anger is the emotion that is the most difficult to cognitively influence. You can influence some emotions cognitively for a while, but also not permanently. But when it comes to anger, the failure of that approach is the most obvious. Since it's the nature of anger to get into a specific mode of automatic, quick reactions and outbursts that were usually designed to protect you. So it is the nature of anger to get a tunnel vision. So when you are in it, this rational approach will fail even more so. But a rational approach to any emotion is futile. Just when it comes to anger, it is more obvious. Now, what I'm proposing to you is the idea of not managing the anger cognitively, rationally, but to process the anger in a way that your emotional structure changes. Now, what's our emotional structure? I prefer this term emotional structure because it gives us an idea like the following. We imagine we are made up of a way to react to certain experiences that come from the outside. You see something, you experience something, and then you will produce a reaction, which includes emotions in most cases. And the way you react to these things is basically your emotional structure. And this emotional structure is not how you think about things. It's not your idea about things. Because you can make big plans like, okay, next time XYZ happens, next time your partner, your life partner says something to you, you make the big plan. Oh, I will then, instead of getting angry, I will then do XYZ. And you, me, and every other human being on the planet literally is proof that that does not work. It will not work that way. If it's something minor or something tiny, yeah, it might work. But for anything that has more profound roots and leads to what then people would call anger issues, so a repetitive pattern that is notorious, that really impacts your life and really has a negative impact on your quality of life, because you realize, that reaction is inadequately strong towards what's actually happening. I'm not really only reacting to what's happening, I am reacting because it is the way I am now. You know that. Then you can say, all right, I might want to work on that. I have an anger issue, which is just a label and doesn't really help much. But okay, that's why you're here. Maybe that's why you're listening to this. So the first result from this, the first takeaway is the cognitive approaches, no matter how sophisticated and logical they sound, and oh, that's a great idea. I mean, of course, when you're calm, it all sounds like a fantastic idea, but the moment you get into it, it will not be possible. It really will not be possible to stop it then. So the only chance you have, but the best chance you have, is to change your emotional structure in a way that anger might come up, but it will not be as strong. Because if your reaction to situations has an anger level from 0 to 10 of, say, 7, 8, 9, it is a big deal to already reduce that to 5, 6, or 7, you know. So here we come into, making goals that are achievable, etc., etc. But it makes a huge difference for yourself and also for your environment if your anger is brought down from 8 to 5. Another point about anger is that from my perspective, anger is one of the easiest emotions to work with. And that might sound surprising and might even be frustrating to hear because, if anger has such an impact on your life, and now I'm saying it's the easiest emotion to work with, or one of the easier emotions to work with, you might be, okay, all right, okay, dude, okay, what are you talking about? Why do you say that? I say that to, instill hope, because with the right techniques, it's really not difficult to work on the anger. It's simple, it's effective, and that's why I really like to work on anger with people. Whenever anger comes up, I'm like, okay, that's going to be a simple one. The technique I almost always use when anger comes up is bilateral processing. That's a technique that can use a tactile stimulation on the knees, on the hands, which includes a bilateral, a left, right, etc. stimulation on the body by, for example, touching, or the person touching themselves. It can be auditory. There are applications for that where you have a left-right auditory stimulus. It can be visual. It can be the movement of the eyes, well, where the practitioner would move their fingers in front of the eyes of the person. The receiver of care not moving their head, just moving their eyes left, right, and processing an emotion like that. That needs, of course, a bit more than that. There's a protocol how to do that appropriately, and emotional stabilization has to happen before using this kind of technique. It's very efficient, it's evidence-based, it's widely used. It's being popularized under different names. I prefer the term bilateral processing because it's the generic, non-trademarked term of the technique. So that's what you should look for. But there are other acronyms, and it's always people starting to sell things which are out there under their own acronyms and names, etc. So that is the technique to do it. Now, when you have been dealing with anger over a longer time, usually decades, your whole life, you will already know that there was a cause for the anger. Usually in childhood, we were hurt in childhood, experienced things, and then later in life, getting angry was a way to cope with that, to cope with the unprocessed pain, and that was then triggered whenever, something happened that where we felt, okay, we might, where our emotional structure produces anger. It's just a simple fact of life that you just do that now. It's not an idea that makes you do it. And in the same way, it's not an idea that will help you not do it. I mean, maybe if you have lived a couple of decades already, you will say, yeah, it's gotten better. Well, great. But if it keeps getting better at that pace, you have to become 150 until maybe it's on a level where you really would say, okay, I'm over that. I'm not reacting like this anymore. So just sitting it out and waiting and thinking about it is really just not an option for most people who want to live their life differently. So you need a targeted approach and purposeful action in order to change that. Now, if someone wants to work on anger, that person has to be trained to work on psychological trauma, on emotional trauma. Why is that? Well, as I said, the root cause of the anger usually is the pain in childhood, usually. And without processing that, there is no chance to permanently change your emotional structure, because the way it goes, you start processing bilaterally the actual anger. And then what you will produce in the process is the emotions that you actually would need to process, the emotions that are behind the anger, the emotions that are being covered up by the anger. And you will have to go through that with the proper techniques. So you see, it is really not so much about the anger. The anger is just the symptom. The actual work is working on what is behind that. So you need somebody who can do that with you. And again, a cognitive, rational approach will here regularly fail you and let you down. It's just not the right way to approach it. It's futile. And if people still attempt that and do that and sell anger management courses, information, and whatnot, where that is taking place, well, this is a little bit like, I don't know, selling certain workout tools on TV, where you're just giving that to people and people buy it and then they use it once and then they put it away, and some fancy toy, but it doesn't really get the job done. And it's the same here. You can sell that because, yeah, people are in need and suffering from that, and it won't do much. But you can then blame the user. You're like, oh, yeah, you haven't used it. But there's something missing. It's just not the right approach. It's like when I don't know, you buy some toy in order to lose weight, for example. Well, it would need a different approach. You have to attack your nutrition, right? So it's in the same way, this notorious myth of, well, you have to manage your anger, and you should look at it like this. And whenever the anger comes up, you should do it won't work, And the proof is there. It's everybody. I mean, there might be, people who say, okay, a cognitive approach has worked for them. Well, congratulations, but it usually doesn't. So you start with the anger, and then other stuff comes up, which is, when you do it well, it's right away the core of the problem. And then you need the skill to work through the core of the problem, to restructure the emotion of the person. If you can't do that, you cannot work on anger with people. So that's the skill set that somebody would need. And that's what you should look for in someone when you want to change something about that. Now you might ask, okay, I want to get rid of the anger. I want to reduce the anger. Do I have to process my whole childhood and all the trauma I've experienced? The answer is maybe, but not definitively. So yes or no, you will have to process for sure a part of it. But I advocate only process as much as necessary, because all this emotional work and emotional labor, when you do it with someone who knows how to do it, it is surprisingly efficient and it gets the job done. It's fascinating and all, and it's really, it's going to be the most, the best hours of your life you will invest like I have when I went through my process. Like that was definitely time that was so well invested. Um, but still, it is effort, it is time, it is money. So you want to prioritize and be like, okay, my main goal is to reduce the anger. This is what's impacting me. I do not have to really clean out the wardrobe completely. I want I want that as my primary goal. So if your provider of care knows that, and this is the defined goal, then you would go for that and just do as much until that goal is reached. And certain other topics, issues that are still there um, could be put away and put to the side. You don't have to drag it all out and work through all of it. It really doesn't have to be done. When I work with individuals who have complex trauma or childhood trauma, which usually spans 1 or 2 decades of their lives or years, I mean, a lot of things have happened in that time. So the way I do it, there's a minimal kind of effort you have to make in order to produce some meaningful results. You have to give yourself time for proper stabilization before anything else, and then work through the topic. So it is 1, 2, 3 sessions where I would say, okay, someone should be committed to 3 intensive sessions. The first 2 being usually around 2 hours long. So that's something. So this is usually something where I say, okay, that's the core of it. Most of the work happens there. That's something you should plan in. But how much you then need after that really very much depends on how far you want to go, if it still contributes to your main goal that you have set for your process. It might be that the anger already has been reduced to a level where you say, oh, I can live with that. And even your, the people around you give you that feedback. Oh yeah, something has changed. We really notice a difference. It's really different. And once you have that, you can be satisfied and be like, okay, good enough. This is why I only schedule session by session from a certain point. The first 3, 4 sessions, I'm saying, let's make that a regular thing so that you do not have to ask for a session and you can also plan your budget and your time. This is what you are going to need. But after that, it usually becomes the decision of the receiver of care. And I'm sometimes touching base, checking in, and okay, how's it going? Are you doing the exercises that how's that working out? Do you have any results you want to talk about? Sometimes it's just this touching base and just having a quick check-in, and it's usually written nowadays, on a messenger, and you can just say, okay, how's it going? Okay, no, it's going fine, I'm doing very well, da, 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 or not. And then you can make a decision together. Okay, do you need me? Do you? Shall we do something, just a 40-minute thing, shorter? Or I can give just an impulse and an idea and direct and give some guidance um, on how to make some fine-tuning in the exercises that the person is doing. My main goal is always, and it should always be to, and here I'm using a buzzword, empower, what that means. And what it means for me is making you or the receiver of care as independent as possible. There are moments where you need that stability of the relationship between receiver and provider of care. Yes, but you can very, very early in the process, from the first session, empower by giving exercises that the receiver of care can do by themselves. Like with physical training. If you have a personal trainer, you wouldn't just go there once a week and work with the person. You would keep doing what your PT tells you in the time in between, because the real success happens in the time in between. There's so much time happening between sessions. There's life happening too, but there's also time with opportunity where you should practice certain things. And it's the same for emotional work. There are exercises you should do in order to actually move through this process as quick as possible and with fewer interventions. And just thinking about things is not what I mean. I mean actual exercises where you sit down or lay down and you process things in the way that was discussed before, and you have already practiced that. And that improves your outcome like a lot. So that's not so much related only to anger, or to work with anger and the root causes of anger. That's a general idea, but that's also something I always suggest to look for. That's the approach. How many tools do you get that you can actually use in between sessions? Do you get something useful, meaningful there to reduce the session time? To my students for becoming practitioners, I always say there's so much pain out there. There is really no reason for you to keep receivers basically on coming back. Make them as independent as possible, as soon as possible. They will come back when they need you, and that's such a and this is such a satisfying attitude, because you can help more people. It's just a better way to work rather than only working in the actual session. Allow me to repeat one thought that I have already shared, but I feel the need to repeat it because it goes against a very engraved, notorious misconception that is out there, and that is this idea you understand the root cause of something and that will change how you feel about it. Unless there is some new information in there. For example, you were feeling about a certain event in family event, for example, you were feeling in a certain way about it. And out of a sudden, you receive some new information about what some person did to someone. That will change how you feel about things, probably, because there's new information. But the events of our younger years, our childhood, who have created our emotional structure, just thinking about them again and understanding the connection that they always have with the way we are in the present, it will not change how we are, how we feel. It just won't happen. So when people start saying, oh, I have analyzed and reflected about my past so much, I understand where everything comes from, I'm thinking, well, good for you, but now let the work begin. I mean, it's okay that you know where stuff comes from. That's not inherently that's not inherently bad, but it also really doesn't change anything. It really makes no difference. And what you need, and here I'm trying to give you really these words and then really meditate on them, is you need exposure to the painful emotions after proper emotional stabilization that is giving you the tools to not get overwhelmed by it. And that in the proper setting and context and choreography. And if you do that, accompanied by someone who knows how to do it, then you will actually process emotions in a way that your emotional structure will change. Your way of feeling about things will slightly but profoundly change. And that's what we're looking for. And that's the only goal worth achieving, so to speak. If that does not happen in a process with someone, nothing has happened. That has to happen. And that will then serve the goal you are having. And interestingly, people set a certain goal, and by making that change on a deeper level, on an emotional level, on the level of their emotional structure, other things will change too. So you cannot only work on the anger. You will also always affect other issues. And that's a good thing, because the anger might be the thing that's troubling you most. That's the thing that is most impacting your quality of life and annoying you and others. But once you have reduced that, okay, there might be then something else. And I'm not implying that that then will be a never-ending story. No, it's already great, you make that shift. But the work will also change other things that are maybe, neurotic, and you thought is just who you are. Deep work will always impact different areas of your personality, of your life, and of the way you emotionally react, because these things are always connected. So you will have noticed that I am not giving you a beautiful speech very eloquently of what are the root causes of our anger. You know all that. You know all that. It really does not change much. And in a way, all these so-called experts and the smart people who explain you so well where your anger is supposed to come from, I mean, yeah, good for you. You figured that out. Pretty easy. That is the easy part, just talking about the anger. The actual real deal is assisting people working through it. That's the real deal. And that's worth our time. So let's do that. And I mean, I'm through it. So many others are. And join us. Our life gets a bit lighter without having to react in that way. Because this is really what life is then. You have to react that way. And it's really not your fault. The techniques are there. That's the way to do it. Look for these kind of approaches. Deep emotional work is one way to approach it. This is the way I call my system. So that's something that you can do, or something that does it similarly.